Now, once you have assessed the patient in detail with ocular trauma, one should know how to go about and examine this particular case of ocular trauma. Obviously, ocular trauma can be examined as we examine the eye, and the steps that are usual part of the eye examination will be followed over here, which basically starts off from the inspection of the eyeball. First of all, a complete detailed inspection of the eyeball with and without a slit lamp. So along with the slit lamp, you're going to examine all of the structures that are surrounding the orbit. So it can be the eyelids, the structures that are basically including the muscles, the skin, the fascia. All of these are going to be examined in detail just to know what kind of an ocular trauma has occurred. Whether it is a blunt kind of an ocular trauma, which can be visualized as bruises or lacerations if it is severe enough or the impact is severe enough. And then on the other hand, we have the ocular trauma with the sharp weapons. For example, it can be the incised wounds or it can be the stab wounds, such as the penetrating or the perforating kind of traumas, which can basically occur to the eye. On the other hand, regardless of all of these blunt injuries as well as the sharp penetrating injuries, we have the chemical injuries as well, which can damage a lot of structures. It can damage the cornea, the lens, the iris. And sometimes these changes or this trauma is, or the damage that has occurred to the eyeball is quite irreversible. So knowing this particular case, then basically assessing what kind of the mechanism has occurred over here is very important, because the treatment plan is going to lie upon the facts that what are the findings of the examination. So one should know how to carry out this detailed, complete examination in case of ocular trauma. When we talk about even the minor injuries, for example, it is the corneal aberrations. It can be sometimes quite minor or on examination, but the person or the patient himself or herself will give you histories of extreme irritation, redness, and itchiness in the eyes. So these are the aberrations, or these are the different symptomatologies that you have to go through whenever you case of an ocular trauma. Now, examination is very important over here, a complete detailed examination. The steps of examination would start off from inspection, then evaluation by conducting different tests, for example, visual acuity, visual field testing using the Amsler's grid, and then of course you can perform the ophthalmoscopy or the fundoscopy just to evaluate any trauma or any damage that has occurred to the retina or the structures in the posterior chamber. So first of all, any of these steps has to start off with the anterior chamber, then the posterior chamber, then the extraocular structures, and then the neighboring structures even. Any nerves can be damaged if there is any fracture of the bony structures of the orbit as well. So the walls of the orbit has to be examined in detail. Sometimes we have to carry out the x-rays if there is a need to perform these x-rays in AP and lateral views. We'll carry them on just to know whether there is any fracture that can be diagnosed at this level or not. Then we're going to move on to the repair that is quite needed in a particular case. So it can be a surgical repair that is devised to a person. Then it can be some sort of a medical treatment that can be devised to a person. For example, if it is a case of a chemical injury, no surgeries are needed. It's just the application of steroids, antibiotics, and all of these systemic antibiotics can be given just to hinder the appearance of any superimposed infections that can occur after trauma. So knowing the need of these particular treatments in all of these particular cases is very important. Then we're going to move on to the lacerations. Laceration is any jagged injury that occurs due to the cause of the blunt weapons. So that we should know that what kind of lacerations we can have. It can be the lids can be involved. The orbital structures can be involved over here. So one should be well versed with all of these structures, and if any lacerations do occur to these structures, how do we go about and perform the repair or the reconstructive surgeries in these cases? So that will be discussed over here in this very second section. First of all, moving on to the history. History is very important. Complete detailed history is very important. In case of an unconscious patient, you're going to perform or you're going to record this history from the close relatives or even the people who have brought him to the hospital. They can give you the preliminary history regarding the object that caused the trauma, what was the situation at the scene of trauma. That can be basically explained by these people, detailed as possible. And time and nature of the injury is very important. Measles, blunt injuries, foreign body remainings, chemical injuries, all of these injuries. What is the final diagnosis in this particular case of trauma that we're dealing with? The past ocular history is very important. Previous visual acuity and lid functioning is very important. And remember that a trauma is a recurrent pathology. So it's very important that you know this past ocular history and this past medical and surgical history. Medical history would include any systemic illnesses that the person is suffering from, and the past surgical history would basically include any surgical procedures that has been carried on in this particular person. Medical history would also include tetanus, the injection of the tetanus if it is given in previous 2 or 3 months, the anticoagulative therapy if it is given. Then we'll move on to the examination. Rule out any life-threatening injuries. So whenever you have a patient of trauma, may it be any trauma, you have to basically stabilize the patient first of all. It has to be the airway, then the breathing and the circulation that has to be stabilized. All of these systems has to be stabilized first of all. And if he's suffering from any other trauma, which is life-threatening, you have to stabilize the patient first of all. Rule out the globe-threatening injuries at this level and examine both the eyes in detail just to rule out whether there is any hidden injury in the other eye or in the bilateral eye or not. Assess the lid trauma, and basically you're going to completely examine the extraocular structures, take photographic evidence if possible, and that is basically, and document and write any injury in detail when you're writing down the medical legal report, or even if you're writing down a simple history in this case. Plan for repair is very important. You're going to make a particular treatment plan that is designed for this particular person. Because if it is a case of a blunt trauma, the treatment is going to be completely different from a case of a penetrating or a perforating sharp weapon injury trauma. And on the other hand, if it is a case of a chemical injury, it is going to be a completely a different treatment plan in all of these cases. So over here, you can see that this is basically the abnormal eye movement that can be observed by the person. The basal tear of the iris can be seen over here. Foreign body, if it is, you have to look for these foreign bodies. If you can locate any foreign bodies, they have to be removed. A distorted pupil is again going to highlight that some sort of a trauma has occurred. A deep laceration orbit, beware of the intraorbital penetration and the retinal foreign bodies. And over here, there is a hyphema. Hyphema is basically the collection of blood in the anterior chamber. So this is the hyphema is the mainstay or a very direct evidence towards the ocular trauma. Subconjunctival hemorrhages, if it tracks the posteriorly, beware of the fractures. And epithelial loss may be missed out without fluorescein. So fluorescein testing is very important just to know if there is any corneal aberration or if there is an epithelial loss over here or not. Then medially, you can observe that we have the marginal lacerations. So you always have to refer this to a surgeon whenever you observe all of these changes, and you have to refer along with a complete documented history that you have at your hand. A tissue loss is very important. The layers of the lid have to be examined in detail over here, and the lid margins have to be examined. The canaliculus and the whole lacrimal apparatus is even important over here. So you have to see whether it is in complete functionality or not. A prolapsed fat septal involvement is very important. Levator functioning has to be assessed just to see if there is any sort of a traumatic ptosis that is observed in this particular patient or not. And then lag of thalamus. Lag of thalamus is basically when both the eyelids are not moving in conjugate motions bilaterally. So this is very important. This lag of thalamus has to be examined in detail over here. The canthal tendon or the angle has to be examined for any marginal tears. So, because this is a very sensitive area, so the marginal tears, if they are found any, you have to refer the patient to the eye surgeon. So basically, whenever we have a blunt eye trauma at our hand, we should know how to diagnose this case where the mechanism of injury is a blunt kind of a weapon. Usually, we experience this black eye phenomena as seen in this picture. Now, what is the basic causes or what is the basic pathology behind this formation of the black eye? After a blunt weapon injury, it's usually the loose areolar tissue that is surrounding the orbit and where the accumulation of the oozed out blood is quite easy. That is basically giving the formation or the picture of a black eye in this particular case. So the tests or the investigations that are usually carried out in this case of blunt weapon injury are the CT scans, just to rule out any fractures or any other foreign bodies that can be part and parcel of this blunt eye trauma. On the other hand, sometimes it is quite difficult to examine or just to have a review of the posterior eye chamber in these cases of the black eye. So the X-rays and the CT scans are the mainstays of the investigations over here. If it is a case of a foreign body, one should know how to treat or how to deal with these imageries. If unable to determine the posterior aspects of the wound, it is sometimes required to perform these CT scans and these X-rays to rule out any orbital injuries or any fractures or any other injuries. Even it can be the roof, the floor, the medial or the lateral walls of the orbit that can be involved. Now, knowing the relations towards these walls is again very important. The structures passing through the superior and the inferior orbital fissures is again very important, because any fracture or any trauma to these structures can result in a finalized or a resulting trauma to all of these relevant nerves and other extraocular structures. Repairs, when devised and how to devise them. This decision is very important when you are making a treatment plan in a particular case of ocular trauma. The timing is very important. Usually the repair procedures are carried out within 24 hours of the trauma, and after, if it is carried out as soon as possible, the prognosis and outcomes are much better in this particular case. Ideally, it is within 12 to 24 hours of the injury. It can be delayed for about a week in a person if it is due to some other life-threatening injuries that the person is suffering from, and you have to stabilize the patient and then perform the ocular surgeries. So knowing the past medical history, knowing the past surgical history of the patient, and knowing the systemic diseases that the person is suffering from is again very important over here. The patient particulars are very important: the age, the gender, the socioeconomic status, the presenting complaints, the mechanism of the trauma is very important. Gross swelling, if it is encountered. Ice packs are given to reduce the swelling, because the surgeries or the repair procedures cannot be performed otherwise in a very precise manner. So you have to reduce the swellings first of all, and then give the steroidal treatment to counteract any inflammatory actions that are taking place at the site of trauma. Anesthesia has to be given. It can be chosen from general anesthesia or local anesthesia at your hand. The general principles that are followed down whenever you are carrying out, obviously you're going to design a particular repair procedure for that particular patient. It can be an eyelid surgery, it can be a surgery regarding the cornea, the lens dislocation, or even the iris can be damaged in a lot of cases. So it is depending upon the case that you're dealing with, and these particular principles are going to be depending upon the case. But then there are some general principles that you have to follow whenever you're carrying out these repair procedures. Now, these general principles would include: you have to clean the wound completely. The procedures are going to be carried out in the aseptic conditions. Remove the foreign body. If it is a case of foreign body, you have to remove the foreign body at the first and the foremost level. Minimal debridement is given, because the prognosis and outcomes would depend upon this debridement procedure. careful handling of the tissues. It's not a tissue that can be debrided to any level. Minimal debridement, and along with that, you have to carefully handle all of these structures, all of the surrounding structures in this particular case. Careful alignment of anatomy, lid margins, lash lines, and skill folds, etc. is needed over here. And then you have to close in layers. So it's very important that you close the wound in layers, and these sutures are sometimes very minute and self-absorbing in nature. So just to have the complete and a very fine surgery, it's not a case of any massive surgery that is performed. It is not relevant to any of the normal surgical procedures that we perform, because eye is a very delicate organ and you have to perform these surgeries in a very precise and a delicate manner. Then if you are dealing with simple lacerations, it can be minor partial thickness lacerations at your hand. It can be steri-stripped if not under tension, and then you can perform sutures, or you can give sutures that are self-absorbing in nature in most of the cases. So 6.0 and 7.0 absorbable sutures. These are the self-absorbing sutures, the kind of self-absorbing sutures that are used over here. They are gut or vicryl sutures, and they're usually non-absorbable in nature. Remove at 5 days if non-absorbable. So if you're using the non-absorbable kind, they have to be removed at almost 5 days interval. If you're repairing the deep lacerations, you have to repair them in layers as needed, and identify the septum and do not attach to muscles, skin, or ptosis. Risk of the lid lag or lag of thalmos. Lid lag is basically known as lag of thalmos, or termed as lag of thalmos. It can be a post-operative complication in these cases of surgical repairs. The approximate lid margins are taken. The tarsal plate is first of all repaired, and then 6.0 vicryl sutures are usually used, and they can be used for traction, 3 to 4 sutures to plate. And spatulated needle is very useful at this level. Aligned lashes and silk sutures are given over here. Skin sutures are given. Nylon or gut or vicryl sutures are one of the kinds of the skin sutures that can be given. So these are usually the repair procedures that are given, and the different sorts of sutures that are used. Accordingly, you have to identify the case, and then you have to decide what kind of, whether it is a vicryl suture, whether it is going to be an absorbable or a non-absorbable suture. It depends upon the case that you're dealing with. So over here in this section, we just summarized the assessment of the patient of ocular trauma. How are you going to assess the patient, perform the examination, the required investigations in a particular case of ocular trauma, and finally perform the repair surgeries to get a complete and a better outcome in a patient. So that is the end of the section. Thank you for watching sqadia.com.